Administering transdermal medicated patch disc. At the completion of this module, the student should be able to apply transdermal medicated patches or discs. Transdermal medicated patches have steadily increased as a way to administer medications. These medications, while administered topically, are absorbed through the skin and affect the client systemically, much like taking a pill affects the client. The medication is absorbed through the skin at a steady rate. In fact, this route of transdermal medication administration is good for medications that are not absorbed well if swallowed or too quickly used up by the body. Patches may be easier for people to use than having to remember to take medications at certain times. It allows a constant amount of medication to be in client's blood system. It does take longer for the drug to take effect for someone just starting than if they were taking the medication by a different route, such as by mouth. Procedure 1, perform skills in general medication administration checklist. When checking the patch against the MAR, be sure to check the expiration date of the patch and that it does not expire within the time frame it will be on the client. Check the MAR for directions, where to put the patch or disc and how long to leave it on. Patches vary in how long they stay on, ranging from a few hours to weeks. Check the MAR to make sure you know how long this client's patches has been on and when it should be changed. The patches should be changed around the same time of the day each time it is changed. Number 4, cleanse hands. Number 5, put on gloves. Always wear gloves when handling both new and old patches. Number 6, if the skin is dirty where you place the new patch, wash it with soap and water instead of alcohol, because alcohol dries out the skin and the patch will not stick as well. Medication administration, a medication aid training course. 7, remove the old patch to avoid giving the client extra medication. 8, if the previous patches leaves a residue, wipe off the excess medication, cleanse the old area with soap, water, and pat it dry if necessary. Number 9, before placing a new patch on the client, date, time, and initial the patch so that those giving medication to this client later know when the patch was placed. Number 10, rotate the site where the patch is placed. There should be a guide on the MAR as to where the new patch/disc should be placed on the client's skin. Some patches cannot be placed in the same place again for a week, so check the MAR. Number 11, make sure the site you select is clean, dry, not irritated, is free of scratches and cuts, and hairless. Broken skin can make the medication go into the skin too quickly. If you need to remove hair, do so by clipping versus shaving the area to avoid small cuts, which again will make the medication absorb too fast. Number 12, avoid applying the patch to an area that is very active, such as the forearm or hand, because it might come off with constant motion and increased movement. It may make more blood come to that area and cause the medication to absorb too fast. Date, time, and initial the patch prior to placing it on the client. When applying the patch, usually the patch or the disc has a cover that can be removed half at a time. Remove one half and stick it to the client's skin. Then remove the second half to allow for a smoother application. Try not to touch the medicated side of the patch. This is the sticky side that will be going onto the client's skin, not the patches. Note the patches are expensive and you do not want to waste one, so be careful not to get the patch tangled and stuck onto your gloves. Document on the MAR when and where the patch was applied and anytime the patch is removed or changed. Discard the old patch by folding the sticky side in half on itself. Place the folded patch into the package the new patch came out of and place in trash container. This is not accessible by children. Confused adults or pets that may live with or visit the client. There can be enough medication left on the old patch to hurt the client, child, or the pet. Remove gloves and throw away according to agency policy. Cleanse hands. Check patch each day, even if it's not due to be changed, to be sure it continues to stick well. If the patch becomes loose or fall off before it is time to replace, check with your supervisor as to what you should be done.